in private insurance, mental health coverage is very weak, to summarize, and that a lot of times you could have private insurance coverage, but you're really not getting coverage for what you need in the mental health area. So, we would absolutely agree with you on that. I think there are two issues in the context of healthcare reform. First of all, again, I come back to the issue of Medicaid. Because Medicaid can support the kinds of services that you all do. Now, maybe all of your populations are not Medicaid eligible, but hopefully we can make some progress on that side. But the kinds of support services that you provide, that's exactly what makes Medicaid different from private insurance. And that's exactly why I think we can't just turn Medicaid into private insurance, which is frankly what some people are pushing for. Let's just put everybody in the exchange. And you can see that there's some attraction to that because you want to mainstream, you don't want to segregate poor people necessarily, but we have to remember the reason that we have Medicaid is because private insurance didn't work for these folks. It was either too expensive or it didn't meet their needs. In the case of people who have chronic and disabling conditions, the private insurance package just did not meet their needs. And also Medicaid has supported all of the critical safety net services that you all provide in school-based settings and elsewhere that private insurance is never going to do that. So there's sort of two ways to think about that. One is that we really have to maintain the strength of the Medicaid program through the reform. And the second issue, I think, from a kid's perspective is that there will be discussions about what the benefits package is in the exchange, whatever we end up in. And so the issue of having a pediatric benefit standard, and it's such a critical issue for adults as well, but it's possibly going to be two different discussions. There may be some effort. Again, there will be pressure not to define the benefits package. The insurance companies don't want the benefit package defined in the exchange. We, of course, would like to see a strong benefits package and a well-defined benefits package. And I think the issue will come up for kids in particular. Will there be a specific pediatric benefit, and how strong a definition can we get? So those are the two places, I think, to keep an eye on it. Yes. I think if I can summarize your question, I think what your question, that in our parlance of healthcare we call it the individual mandate. I think that's what you're referring to. And basically what that is a proposal, and this is the case in Massachusetts, on the adults anyway, that everybody is mandated to have insurance, like car insurance. Everybody has to have health insurance. And so that's an issue, and it's funny, I guess, harkening back to my past, when I started working in '94 in Clinton healthcare reform, that was Bob Dole's bill, was to have an individual mandate. So times have changed, and now there's a much, I think, broader receptivity to that idea. And President Obama actually had an individual mandate in his campaign proposal for children. So the key issue with an individual mandate, I mean, you can see the issue where when you're talking about insuring everybody, everybody's got to be in the risk pool. You can't let the healthy people be outside the risk pool because it brings, up people's costs, and you have what's called an adverse selection problem where you kind of spiral around and the sicker people get insurance and everything collapses. But the critical issue is you cannot have a mandate unless, A, it's affordable for people. So there's a strong subsidy structure to make sure that people are not facing a mandate that they simply can't afford. And secondly, I think equally important is that you have to make sure that our systems for enrolling people are super welcoming and simple. Because we have a lot of folks who are not, as we talked about, eligible but unenrolled because of the red tape they face when they go to try to enroll, or particularly when they try to retain their coverage, when they have to re-enroll. A lot of times families drop off at that point. So we've got to have simplified eligibility, we've got to have continuous eligibility, and we have to have a really strong subsidy structure in place, I think, before something like a mandate could be feasible. So the other, I think, interesting question and sort of weird dynamic that I think all of us are facing is that it's really hard to look at these issues in isolation. And so, if you're talking about a massive reform of our healthcare system, there's so many interconnected pieces. And you really can't assess, well, is that a good or a bad thing, without seeing the whole that they're kind of putting people into. And that's difficult. And one of the ironies of how policy gets made is that it's not always terribly rational, as you know. And so you have different staff people working on the Medicaid area versus working on the exchange, and so all these kind of interconnected issues, unfortunately, don't always get seen, in that interconnected way. So I think you raise an excellent point, and certainly something that I think, all of your members need to hear about, the kinds of realities that low-income families face and what, barriers they face, and that we've got to address those barriers before we start punishing them. The question is really about, given all the very difficult state budget situations that almost every state is facing, is there really an ability to go forward with expanding children's health coverage? Because even though there's more federal money on the table, states still have to put up their matching dollars. So excellent question, and I would say two things about that. One is, as you know, as part of the stimulus package, Congress did provide significant federal funding for a temporary period for the next 2 years through 2010. And those enhanced Medicaid dollars are coming now into states. And as part of them, the agreement is that there's what's called a maintenance of effort. So states are not allowed to cut eligibility in their Medicaid programs. And some of you may be from states where you've actually seen cuts rolled back because of that maintenance of effort provision in the Medicaid program as part of the stimulus bill. On the children's health coverage side in particular, I know I have been actually quite surprised that we've seen, in this legislative session, we've seen a handful of states that are going forward with kids expansions despite these very tough, difficult circumstances. Colorado just passed an expansion. Arkansas passed an expansion to 250. Oregon may be moving forward, and there's another state that I'm not thinking of at the moment. So we've been seeing momentum. We're still seeing momentum, and I think it's important to stress that in these tough economic times, families need this coverage more than ever. Families are losing jobs, and going along with that, they lose their health coverage. And this is critical to make sure that kids remain insured during these very difficult times, so that as tough as the state's budget, families' budgets are worse. And this is a critical piece of providing them with support so they can get back on their feet, get back in the workforce. Right. Well, then that's, just not to get too techie, but one of the issues in healthcare reform that we've been highlighting is the need to have some kind of automatic stabilizer for Medicaid funding during times of recession. If we're going to build on the Medicaid program, we've got to have, Congress has stepped in the last couple of recessions. It stepped in this time in the stimulus bill, and in the early part of this decade did also provide some enhanced match. But we need that to be automatic. So that is something the committees are considering right now, to have some kind of automatic stabilizer where your federal matching rate would go up with your unemployment rate going up, or however they end up doing that. But I think that's an important piece for folks to mention, and that is something we talk about in our Medicaid paper that I mentioned, the role of Medicaid in healthcare reform. The question is about the Mental Health Parity Act and how is that going to interact with whatever happens in healthcare reform, and I should say that I'm definitely not an expert on that. I think there's a very active, well, let me say first off, they also included a mental health parity provision in the CHIP bill. So that it's kind of a weak provision, which is sort of why I didn't mention it, but you can read about it in our summary. But it's basically saying, there has to be some parity. If they offer a mental health benefit, there has to be parity. So it's a little weak. But in any event, I think the point is that at least the concept of mental health parity is well cemented into the congressional mind at this point, which is good as they approach healthcare reform. Now, there's a super active coalition of groups that work on mental health issues, and I'm sure that they are engaged in this question and looking at it. So I think the problem that's going to come down to, from my non-mental health expert point of view, is really where we end up in defining the benefits package. And there's just a lot of pressure around that question. And to the extent there's not as much money in the bill, it's going to be even harder to have a strong benefits package. So there's a lot of resistance to defining a strong benefits package, but that I think is a critical issue from the mental health perspective.